Welcome to the place where we gain knowledge through the lens of creativity. I am Aaron Dworkin, and this is Artful Science. Thanks again for joining me here on Artful Science. Today's show is HeartBeat, Cardiovascular Health Innovations. And my guest is Dr. Chandu Vemuri, who serves as Assistant Professor of Surgery, the Chair of the FCVC Innovation Program, the Ambulatory Care Clinical Chief, and the Vice Chair of Business Intelligence for the Department of Surgery at the University of Michigan. Chandu, welcome to the show.
Thank you very much. Thank you for having me.
So, well, it's so wonderful, and especially it's an honor for me to be able to have you on the show. I am lucky enough to be based here at Michigan with you and see just some of the extraordinary work and leadership that you have at the university, and it really is amazing to see. And so I thought I'd kind of just delve right in. Obviously, your main focus is cardiovascular health. All of us worry about it, and it represents, I think, what is either the largest, right, or one of the largest statistical threats to our longevity. So is there any kind of just overarching important facts from your perspective about cardiovascular health that anyone, lay people, should know or be thinking about that we might not be?
Sure. I think cardiovascular health is something that can be overlooked because the signs and symptoms of disease don't present until an event happens, such as a heart attack or a stroke or something like that. But in between when you're a young adult and that happens is a long period of time, and we don't notice what's going on. And so I think one of the things that's particularly apparent during the pandemic is really to kind of continually take care of yourself. Don't worry about a day, don't worry about a week, a month, a season, maybe 2 years. But over a period of time, do the things that you can do to keep yourself heart healthy. And the components of that are multiple. You have to mentally kind of be free of anxiety and take good care of your health mentally, because stress and anxiety build cortisol levels and other hormones that can have a negative impact on your heart health. You have to exercise whatever way that you find it to be meaningful or beneficial to you. It can be as simple as going for walks, which are a healthy way to be outdoors and talk to others, or it can be running or other things. And then diet's a big component of it, and that also is different for different people based on what your dietary needs and things are. There are some good films out there. There was a film I saw a long time ago that had an impact on me called Forks Over Knives. It's on Netflix. It actually talks about a plant-based diet, which many people, I was unable to stick with it, but there's a kind of key learning principles there about how we view food and what the purpose of food is to us and nutrition is to us. So I think that it's important to remember that when you're thinking about cardiovascular health, it's very much a long game. You have to every day, every year work to maintain your health so you see those benefits decades from now. So you don't have to be in the hospital, you don't have to be on medications, things like that.
Yeah, totally. No, and it's so helpful. And as we think about those types of things, as we think about anxiety or our mental health, we think about diet, weight. Is there amongst those, is there one that kind of has the biggest effect? Like, in other words, if we're like, wow, or if someone, in our audience feels like, yeah, that's great, but with everything going on in my life, I can't do all of them. I can't have the great diet, the perfect diet, and be totally, mentally healthy given everything that I'm facing and all these other things. Is there one that we know has a greater impact, or are they basically all equally important?
I think they kind of interact with each other in different ways. I think, from not a data perspective, from a personal perspective, I think there are a lot of benefits to exercise. And exercise can actually reduce stress levels. It can improve your blood sugar or glucose profile. It can improve your blood pressure. And so if you had to pick one thing, if you have to eat what you have to eat, and you maybe stress the factors that contribute to your stress are out of your control, the one thing you can do to take care of yourself is to find a way to exercise a few times a week. every day. It can be as simple as yoga, which, has the benefits of exercise as well as kind of mental relief, or it can be any other kind of aerobic activity. But I think if I had to pick one, I would go with exercise.
Gotcha. Awesome. Great. Well, very, very helpful. So obviously these are the things that could really be preventative and help us so that we don't have to potentially come and visit you in that way. But this is really the actual treatments is a constantly evolving field, cardiovascular health, and you're really one of the leaders who's, shaping some of these changes. Could you share kind of any key innovations that are happening in terms of the area of actually treating cardiovascular health?
Yeah, and so medicine progresses in interesting ways. And over the past, if you think about the 70s and 80s and 90s, a lot of the progression of medicine came in medical therapy, the introduction of new medications with new targets. You can think of Pfizer with Lipitor or cholesterol fighting drugs. Advances in the treatments offered, meaning we went from more invasive or bigger procedures to less invasive procedures. Open heart surgery was partly replaced by stents. You go home the next day. Big vascular aneurysm surgeries are replaced by stents. You go home the next day. So technological advancements in that sense have a big impact. And then the care of patients, both pre-hospital, in-hospital, and during recovery. So that for the long time was a big part of how we kind of advanced the field. And then I would say over the past 10 to 15 years, and particularly heightened during the time of the pandemic, we've really kind of taken the information revolution and the technology revolution, the personal computer, the cell phone revolution. We've started to see innovation in that realm. And some of that is causing some of that type of innovation. There are products that offer services, but those services are geared towards improving your health. And it can be as simple as people developing a chatbot program that says, okay, it's important for you to walk. And so you're going to engage in this program, you're going to enroll in it. It's going to keep track of your walking, and it's going to give you little reminders like, hey, the weather's supposed to be nice in 3 hours. Maybe it would be a good time to go for a walk. And so we're seeing innovations like that, which I think are important. And one of the things I like about those is that they're personal. It gives you the opportunity to have a personalized kind of program for yourself. So I think that's a big area of innovation. I think another area of innovation is the process of healthcare. I think we've had to change the process of healthcare non-optionally during this time, but there's a lot of things that we learned about how to better deliver care to people that I hope sticks with us. And these process improvements, particularly related to cardiovascular health, it's almost more productive to have a conversation with someone in their own home. With you at your own home, or maybe at work and they're at their home. You get to relate to them in a different way. You see their environment, you see their surroundings. They don't have the stress of being in the doctor's office and kind of feeling that way. And so I think that is an example of how we're kind of changing what we do. There's even talk of hospital at home, which is kind of going back to how we were before we developed big buildings. And so I think healthcare is going through this revolution of how do we actually do things that are personalized and best for the patient. I think we spent a lot of time for about 50 years transforming personalized healthcare. The doctor comes to your house, talks to you in your bed, figures out what you need, and makes a program for you, right? And you can call them and they'll come. To developing these big hospitals that you drive to that are far from your house, not easy to navigate, big parking structures, uncomfortable, long waiting periods. And what we've learned now is people don't want that. Right. And now we have the tools and we have hopefully internet access for everyone in the near future, but we have electronic tools through phones, tablets, the web to allow more personalized healthcare again in a way that we can actually implement across a large population. I may not be able to drive to 50 different people's houses in one day, but I can see 26 people with virtual visits in their own home. And so I think there's lots of evolutions like this that are happening, and we're seeing it also, in medical management where, if you are discharged from the hospital and you have an arrhythmia and you have a monitor, and it used to have to be that you just have to come in to have people check your device or check your blood levels or whatnot, all of that can be done at home, which saves patients time. And it also allows us to transition care from episodic care So we see someone in January, then we see someone in June, and then in December. But with all these evolutions in healthcare, it can be continuous. Every week you can have interaction, and it could be a very quick interaction, but it can still be meaningful. And I think transforming healthcare from kind of episodic care, which is what we kind of built over the past 40 years, to a more continuous personal care model, is a big process evolution. And I think that process evolution may have an impact on cardiovascular health, because cardiovascular health requires daily intervention. And to have a daily intervention, you have to have a daily relationship. And that's hard to do with the current model of episodic care.
Wow. No, it's amazing. And with that kind of continuous care, is it not only that, but do you have the ability now to kind of continuously monitor? So information that you may only got a snapshot every month or every several months, you can know someone's blood pressure or other key, body system information on a daily basis even?
Yeah, and I think, I saw a commercial, I think the other day, for Apple's Watch 7, where someone goes hiking and they don't respond or something to prompts, and it automatically calls 911. That's a high level interaction, but the idea of remote data monitoring is huge. And when we're trying to figure out, both in the Frankel Cardiovascular Center, but I think the world as a whole, how do we best incorporate this continuous data? Continuous data is fantastic. It's very important. It's what we should be doing. Sending people home with a pen and a pad, asking them to write their blood pressure down a few times a day, or saying, check your pulse when you feel funny. We have technology that can get us beyond that. So I think this remote data monitoring is a definite tool in the armamentarium to getting towards continuous care. And the challenge is going to be for us to manage this mountain of data. And I think that's where, once again, we leverage our technology that we've developed. We have algorithms, we have AI. There's a nice converging of technologies right now, where a lot of the different components that we needed were kind of there in isolation before, but I feel like we're at this point where it's coming together. We have remote data monitoring. We have advanced algorithms that can use AI to interpret that data for us. We have large data storage mechanisms. We have better internet, and we have better devices. So I think there's a lot of components of what we needed to get to this place, this kind of future level of care that we actually have now, that we didn't have before. We just need to be smart and use it.
Wow. This is truly, truly extraordinary. And, this has been fantastic. Unfortunately, we're just about out of time, but I always like to ask of all our guests here on Artful Science, where we're at the intersection of the arts and sciences, do you have any arts practice or disciplines that you like to either engage in yourself or observe?
Yeah, there's two things. One is, I used to very much be into digital media creation. So I used to do a lot of digital artwork. It began with posters and things like that. And I've actually just gotten back into doing that. And it's evolved so much in the time that I was away from it. So it's been fun to take tutorials and learn new ways to do that. And I found that kind of expression to be a good outlet. I've also always been interested in music. I grew up listening to a wide range of music. I actually like folk music. I like hip hop. I like country music, particularly 90s country. I like things like the Dave Matthews Band, and my favorite band of all time is Queen. And so I've always had an acoustic guitar, and I've been kind of intermittently kind of going in and out and playing that. But I found those two avenues to be something, things that I enjoy. And I love going to concerts to see musicians perform live. I think that's fantastic to see. I'm excited to be able to do that again.
Exactly. Well, clearly we're going to get together and listen to some more music together. So Chandu, Vemuri, thank you for helping us gain knowledge through the lens of creativity here on Artful Science.
You're welcome. Thank you for having me.